My name is Grossman. I work at GeneDx, Patient Advocacy and Engagement. I came to GeneDx from a gene therapy company, and I also worked at Citizen with Virginia. Loved that time. And I'm a mom. I have a 28-year-old with a rare condition. So I work at GeneDx to help patient advocacy organizations understand how to access genetic testing if they need genetic testing. Now, you all have had a genetic test. But I also help with genomic data and understanding the data that we have at GeneDx. So Amanda Singleton is here with me today, my colleague and genetic counselor, and she's going to talk to you a little bit about who is GeneDx, what do we do, and then we'll talk a little bit about the Discover snapshot that we have up on the screen.
We have to switch.
Okay.
I almost started talking into that microphone, which is not a microphone.
I thought that that's what that was.
Okay. Hi, everyone. Amanda Singleton. Like Gay said, I'm a genetic counselor, and I'm one of many at GeneDx. GeneDx is a genetic diagnostic testing laboratory. We're probably the oldest. We've been around for 25 years, so we've gone through a lot of technology since then. I'm pretty sure we have diagnosed a few of the kiddos in this room, and yeah. But there are other labs, and so what we wanted to talk about is really the data that GeneDx is able to provide to your organization, and we want you to share it with whoever wants to listen. We think all labs should be doing this, but let's start with us. So one of the things that we've always been asked is, well, how many other patients with variants in SYNGAP1 do you have? And so for years, that's all we were able to give. But then Gay and I have become this like powerhouse team of asking our executive leadership if we can give more, and at no charge, and we're getting pretty good at it. And so now we're able to give a little bit more of the data for you to use in grant applications and to entice researchers and entice physicians and pharma companies, because we know that more patients means more research can be done, it's more power to your studies, and it's enables more clinical trials for drug companies. So this is a picture of, we call it a Discover snapshot. Discover is sort of the user interface that sits over our entire GeneDx database, which is called Infinity. It's Infinity because we want it to go on until infinity. We want to capture all of the clinical and all of the genetic information that we have on the patients tested so that we can serve it back to those who need it to develop treatments. So this is a snapshot from Infinity. This is SYNGAP1. We looked at any patient that has a pathogenic or likely pathogenic variant in SYNGAP1. This does not include VUSs. We know some patients, we find a variant, and we're not quite sure whether it falls on the pathogenic side or on the benign side. We might report it because we know that the more we test, the more we learn, and that classification will change eventually. So we want to keep track of that variant. So this snapshot is just pathogenic and likely pathogenic variants, which the American College of Medical Genetics and Genomics says is diagnostic. So these individuals are truly positive. We can also give you the sex breakdown, looks about 50-50 here. The genetic ancestry background of the individuals in our database, which, you know, it's mostly, I think that's European descent. Sorry, I'm blind without my glasses. And we give you the patient count over the last 5 years, because what pharma wants to see and what researchers want to see are numbers increasing, more diagnoses being made. So just organically through our testing, we're seeing these numbers go higher and higher. In 2021, there were only 153 SYNGAP patients diagnosed at GeneDx, and now we're up to almost 350. We also provide the age those individuals were tested. So there's a huge bolus right at that, I think it's 3 to 7 year range. We want to see that number shift. We want it to go younger and younger, early diagnosis. And we also give the current age of the patients based on their date of birth. So it's imputed based on their date of birth. And we give you a heat map of the darker the state, the more patients diagnosed in that state. This is not patients' home addresses that we're linking to. It's the clinicians that tested them. So you can see that there are a lot of SYNGAP patients in Florida, Texas, California, New York, in the GeneDx universe. Again, this does not include other labs that have tested and diagnosed positive SYNGAP patients. So Gay, do you want to talk a little bit about what you see?
So what we do is we provide the Discover Snapshot to, we actually talked to Catherine and Virginia, and we said, okay, here's some data from GeneDx. Like, what does this mean to you? What do you see in this data? And I love calls like this because I'm able to see the reaction, and they both looked at it and they're like, okay, well, yeah, we know some of those families in Texas. That we're not surprised at that. We're not surprised at New York and Florida. But there's some other states that we're kind of surprised at that we didn't really know that we had patients there. There are other states that we kind of think there should be patients there, and why aren't there patients in all these other states? And so one of the things that we do at GeneDx is say, okay, well, how can you find those other families? And this is something that you all can think about. And I like to share with people, I studied English and economics. So when you see data and you think, oh my gosh, this is, beyond kind of what I'm ingesting as a typical mom or dad, you can learn this. And what we do is we have workshops that you can join, and it's just a virtual call. And Amanda and I like really short workshops, like 20 minutes. So you can call and you can call in, you can just listen and hear what other people are asking about and just learn about it and just learn about what this data means. And then what we do is we stay on the phone for the whole hour so that if people want to ask us questions, they can. So we do that every quarter. And you can get that information from Cure Syngap so that you can know when to call in if you're interested. But we think about things like looking at the map and, what do you do about those states that don't have any families? I mean, there have to be other families who are affected by SYNGAP. And so part of my role at GeneDx is saying, to all of you who are involved in some social media, and you see families who are probably talking about symptoms that maybe you were affected by before you got a genetic diagnosis, and you're thinking to yourself, they probably have SYNGAP. They need a genetic test. How do they get that genetic test? So we partner with other companies called Genomic, which actually does it by telehealth now. I've been with GeneDx for 2.5 years, and so much has changed. When I started, whole exome sequencing was a blood test. Now it's just a swab in your mouth. Whole genome testing, same thing. It wasn't as easy to get. Insurance companies weren't covering it as much. It's now covered by most major insurance companies. We worked with the Child Neurology Foundation to make really short videos because, again, we like things that are really short. We know that you guys have other things to do, but it tells you like how to work with your insurance company and how to fight a denial and things like that. So we try to provide resources that you all can find valuable. So when Virginia and Catherine and Amanda and I were looking at this snapshot, what we encouraged them to do was, okay, let's come up with some things that you can really do with this data. Like what really would mean something for your community, and what would something that would be impactful to the research you're doing? Like if we could think about two things. And so what they came back to us with is, we know that there are families out there that probably have the variant of uncertain significance. How do we make sure that those families are going back? So one of the efforts that Virginia and Catherine talked about was we want to do more about talking more about these variants of uncertain significance and making sure those families know to go back and get it reevaluated and see if perhaps there is a gene that can be identified, a SYNGAP gene that could be identified. So, again, being able to do it through telehealth, go back to the doctor that was prescribing the genetic test before, but just making sure that if you have a variant of uncertain significance that you do go back. Now, if you've gotten your testing from GeneDx, you can get that at no cost. We don't know what the policy is of other labs, but just know that if you did get your testing at GeneDx, you can have that reanalysis done. The other thing that we have at GeneDx that's nice is if you were tested at GeneDx, you can talk to a genetic counselor at no cost. And you just fill out a form. the doctor who ordered the test signs it, to referral form that's on our website, and you can talk to a genetic counselor for free. So we try to be here to support not only Cure Syngap, but also the families that make up your community. The other thing we talked about is the states, and like we were saying, they both said, let's focus on those states where we think there could be people, and sharing information about getting genetic testing, and also the states where they're a darker color, meaning there are families there, but maybe they're not connected with Cure Syngap yet. So I don't know if you want us to answer questions, or we want to keep you on schedule.
Sure. Does anybody have a quick question? Back here?
Just a real quick, simple, straightforward one. When we have friends, family, people in the neighborhood that we know, and that kid might have SYNGAP1, what is the easiest way to get them linked up to getting the genetic test done?
Genomic, which again it's not GeneDx, it's just a company that we collaborate with, and they're the ones that are available through telehealth.
Tell them to go to the website, email, how do I literally get to the person and say, do this?
Well, we're actually working with Cure Syngap. We provided a link, and I think you're going to be putting it on your website so that it makes it really easy for families to go there. But it's up to Cure Syngap if they would like to do that. But it's an option that you can go directly to that phone number. I've actually done it with a family member. It took 48 hours for us to get an appointment, and I get a genetic counselor on the phone and decide which genetic test was right for them. They don't just work with GeneDx; they work with all labs. So it's just like a telehealth visit with a provider, and they'll mail the kit to their house, and you do the swab and send it back, and then you have a call afterwards. Now that's different. I just want to be clear. If you get a test, what I was just saying before, you get a test from GeneDx and you can talk to a genetic counselor for free. That's different than calling Genomic. There is a cost, and it depends on your health insurance. So you want to make sure to call your health insurance and make sure it's covered and what the coverage would be. It depends if you've made your deductible. You know, there are a lot of, it's just like if you go get an MRI, you would do some homework on the front end to see what your cost would be.
It's not on the website yet, but it will be in the new year.
Thank you.